my name is Bill Dempster with 360 Public Affairs, as I said before, but working with the Canadian Organization for Rare Disorders for many, many years now, and just thrilled to be able to help organize this webinar today with Durhane Wong-Rieger. Durhane is the president and CEO of CORD, and all of you who registered probably already know that, so I won't go into details except to say that one of the preeminent patient advocacy leaders in Canada, and very involved in everything related to how patients interact with the health system, with each other, et cetera. And thank you all for logging in today. A couple of housekeeping things before I pass it over to Durhane. There is a question box in the GoToWebinar panel that you'll see. Just click the little triangle to be able to open up that. As we are going through this presentation, feel free to start asking your questions there or providing your comments, and we'll do our best to get to most of them. We have a half an hour for this webinar. We might go a little bit over time, but this is the first time that we've done it in a while. So we wanted to make sure that this was working really well. We only booked a half an hour, and I think that might work out well there. But the good news is that we are planning 3 other webinars. There'll be an hour each every Wednesday starting next week. That'll be the 29th of April, and the 6th of May, and then the 13th of May. So we're going to show you a slide a little bit later that you can block your calendars on that. Finally, we have a handout that you'll be able to see also on the GoToWebinar dashboard. It's the PowerPoint that Durhane will be walking through. So feel free to download that from the GoToWebinar dashboard in case you have any problems with the video. So with that, Durhane, over to you. Tell us what the rare disease community is saying to you, and the answers from the survey that you put out. It wasn't out for very long, but I understand we've got over 300 responses. So kick it off, and I'll do my best to moderate and come back in later.
So thank you very, very much, Bill, and thank you to everybody who's on this webinar, but especially thanks to all the patients and families that actually filled out the survey. It was for us an important opportunity to certainly reach out to the patient community to try to understand what is the impact of COVID-19 in terms of primarily your ongoing access to healthcare, but also on people and patients and families as a result of COVID-19. Let me just start by saying that, as Bill says, what we framed this as, what are the lessons we're learning from the impact of COVID-19, and how can we apply those? And this is something that's very critical to improve the healthcare system. And we believe not just for rare disease patients, but probably for all patients living with chronic conditions in Canada. It wasn't what we intended when we sent out the questionnaire. We really were just trying to get a temperature gauge in terms of the impact. But I think this kind of leaped out at us so strongly that we really not only wanted to put this forth in terms of lessons learned, but also we will be following up in terms of recommendations for immediate and also for long term. Also to say though, as a preview to this, is that we are very, very, you know what, I think my slides are stuck. I'm trying to see if I can get them to move now. Give me, there we go. So, just to say very much so that CORD, Canadian Organization for Rare Disorders, is very supportive of what our governments, our ministers of health, our healthcare systems, our hospitals, all of our healthcare providers are doing in response to this epidemic. We're also very supportive of all the measures that are being taken right now to try to protect the health of all Canadians. And that, of course, includes all of us living with other diseases and certainly living with rare diseases. We're also very, very supportive of ongoing efforts that all of us have had to, to make in order to keep everybody safe. So there's nothing in this that is a criticism in terms of what we're doing right now in the healthcare system, what our governments are doing, what our healthcare system is doing. What we did want to be able to do, and you'll see in the recommendations, is to recognize what else could be doing and should be starting to be done, certainly on behalf of our community, but we believe on other patients that are living with chronic conditions. As many of you will know, for patients with rare conditions, many of them who already have underlying conditions, many of these conditions compromise their immune systems, their respiratory systems, their cardiac systems. They are much more susceptible to COVID-19 and certainly to the complications. And so this is why we actually sent out the survey. We're very pleased that we've gotten something like 300 responses very quickly. And we're going to give you some of the highlights out of that. So one of the things that we did learn is we asked about how do people perceive themselves in terms of being at risk in terms of COVID-19. I would say not surprisingly, though I was surprised at the breadth of it. 3/4 said they felt they were at great or very great risk for COVID-19 complications. And you can see, specifically some of the examples there: serious double lung antibiotic resistant pneumonia history, asthma, autoimmune condition, and recent bad flu symptoms. 2/3 said they were somewhat to very concerned about seeking health care because of the fear of exposure to COVID-19. And I think that's probably true for any of you who have had to even go in for, somewhat urgent needs, but certainly in terms of ongoing care. And I think one of the, strong things that came to me was that, we know that we're at risk, and we're also very afraid that if we do get COVID-19, that we're also going to have a very serious complications. So this is something that is probably not surprising, but very much there. I'm going to go through these somewhat quickly, so we'll have a chance to talk a little bit about what the lessons learned and the implications. But as Bill said, the slides are available, and we will have a longer report that will drill down on some of these numbers as well. So what's the access to care? Well, we asked, how's COVID-19 impacted your ability to get access to care? Half of the people said, yes, we have difficulties. We've either had delayed or canceled surgeries. Sometimes these are urgent surgeries. Sometimes these are critical surgeries. Ongoing blood work, dialysis even, physiotherapy. And, you can see some of the examples there. Couldn't get the surgery that was supposed to be taking place. So now I'm actually in bed. I've got a lot of pain. I'm supposed to be getting follow-up in terms of some complications that I've had. Can't do it. My specialist lives in a different city, and I can't get to the specialist because I can't travel. And lots of fear that maybe right now I don't have an issue, but what's going to happen if I actually have? Because many of these diseases on a day-to-day basis may be managed, but of course, they're also punctuated by things like crises, like attacks. So people are very concerned if something does happen. I would normally go into ER or go and see my specialist. What would happen to me? Because I'm afraid to do that. And of course, many of them, half of them said, I can't get ongoing rehab or critical services. And for some of these patients or parents with children, this rehab is critical to their ongoing development, to their ongoing well-being. So it isn't just, kind of an occasional rehab, it is serious regular rehab. So this is extremely challenging. And people who need support care on a regular basis are finding, of course, they can't get the support care to come to their homes, or even if they could, they're afraid to have the support care. So I had a mom with 4 kids who said, you know what, I'm doing it myself because I don't want to have an outsider into my house right now. So this is a huge issue as well. We also asked their access to medication. How is it affecting your ability to get ongoing access to your drugs? And about 40%, which is quite high, 2/5 said, yeah, we had some to great difficulty getting access. What they had troubles with was not exactly kind of what I thought. Regular medicines, they said, were in short supply. Amoxicillin, hydroxyurea, couldn't get it. They were not available. I could only get a portion of my regular supply. I was asked to take a substitute. One and more than one patient actually said that I couldn't get my drug because they're saying they're holding on to it. And because they're going to need it to treat COVID. Now, I don't know that is actually something that's a system-wide a directive, or whether it was something that was being done locally. But this is really the response that some of these patients are getting. Some of it was really logistic, which was quite striking as well. Trying to get access to my medicines, but the computer crashed. I couldn't get it locally. I had to go to 4 different pharmacies. I kept trying to call. And I was afraid to go into someplace local, so I was going a great distance to get it. So this is very important. The example I give here was actually quite striking. I have new medication. My daughter had new medication. She needed to have, catheterization before she could get it. They canceled the catheterization, so we couldn't do it. So I think these are the kinds of things that are more what we say system barriers, as opposed to actually access to the medicines itself, including things like I was supposed to be starting on a clinical trial. I'm trying to get my drug through SAP, and I can't get a hold of Health Canada to approve it, or I need to get some pre-tests that are done to qualify for the therapy, and again, I'm not able to do it. So again, not because the medicines aren't there, but because there are system barriers that are keeping me from getting access. And I think that was really kind of striking, because most patients weren't saying the drug wasn't there. I think that was the problem. And I'll talk a little bit about what the response has been from the industry that kind of backs up what I'm saying here. We also asked, what was the impact of COVID on mental health? 3/4 of the people, not unexpectedly, had some to great anxiety, fear, or stress because of COVID, more than usual. And 1/2 of them said have withdrawn emotionally. And I think this is, probably not at all surprising. But I really felt that this was kind of striking. If I don't get my follow-up, or if I do get it, if I don't get my follow-up, I'm going to have serious problems. If I, do get COVID, I'll probably die if I go to the hospital. I didn't put the example in, but one of the previous ones in terms of fear of going to the hospital, patient wrote that, I'm on a regular medication. I have to go in on a regular basis to get my infusion. I'm afraid to go because I'm tremendously immune compromised because of my condition. So if I go into the hospital to get my infusion, I'm likely to get COVID. If I get COVID, I'm likely to die. But if I don't get my regular infusion, I'm also going to die. I have no idea what I'm supposed to be doing here. And that is the real point. And I can't get a hold of my specialist. So this is, again, an issue. And as I said, a parent, 4 children, 2 of whom have specialized needs, I get panic attacks. I'm deeply struck with grief and anxiety on a daily basis. These kids need ongoing support. They need, special care. And we've got that on top of our trying to make sure that we're able to manage on a day-to-day basis here. We did have some really positive responses. People said, yeah, we can get our healthcare provider through phone or email. We found that the use of telehealth has really helped. We've been able to get work done at an offsite blood lab. A lab worker came to the house to draw the blood. And one really striking thing, different patient, but same issue, care team said, you know what, we're supposed to do the catheterization. We're not going to do it. We know it's an urgent need. We'll just start the blood work and we'll monitor afterwards. I will say is that, as I said before, people did not really say that we couldn't get access to our regular medicines. And so we had sent in a separate survey to the pharmaceutical suppliers. What are you doing? Because we wanted to make sure that supplies were not at risk. And we were, I think, somewhat heartened by the responses we'd gotten back. Almost all the suppliers said that there was no risk in terms of ongoing access to rare disease medicines. And in fact, many of them said that they were taking steps to assure that they were going to have procurement, that production was not going to be, interfered, and that we're going to make sure that we get the delivery here in future needs, even if we're talking about an extended period of time. So we want to make sure we meet the needs of our Canadian patients. Some of them were also saying that, yes, we recognize that patients don't want to go into hospitals for infusion, so we're going to set up sites, or we're going to use some of our specialty pharmacy sites and have patients going there where they can do it without a fear. And we also asked about clinical trials, and nobody responded to say that they were going to be interrupting the clinical trials that were ongoing. And in some cases, they were saying we have to make some special arrangements in order administration. We're going to have to find alternative sites. We'll do follow-up by phone or by home visits, as opposed to having the patient come in, which we thought was, great. We do know that there's some clinical trials that may not be started, and I think that's a concern. But we were very pleased to see that, at least here in Canada, the pharmaceutical companies were really taking the steps necessary to ensure that our Canadian patients were going to be getting ongoing access and not being impacted in terms of what their medications or their clinical trials were all about. I will say, I was on another call with a group in the US and also internationally. We're hearing internationally, certainly in the US, up to 40% of clinical trials are being interrupted. So I think it is a big problem, and maybe because we have fewer clinical trials here, or in smaller numbers of patients, I'm not sure. But certainly we're very, very grateful that our patients are continuing to be able to participate. We don't know what's happening with the patients that are going in trials south of the border, and we will try to follow up on some of those that we know are in those situations. So what are we going to do? And I'm going to move quickly because I know we only have a half an hour. What we will do as CORD, as I say, we are so supportive in terms of what our governments and our healthcare systems and our healthcare providers are doing, and certainly the industry as well. But we also recognize that we need to make these issues and these concerns known. We also feel very strongly that there is a responsibility on the part of the governments and certainly on the part of the healthcare systems to be watching out for the needs of patients with chronic diseases. And we know it's not just the rare disease patients that are impacted in this way. And that it is time now for us to be able to set up some parallel responses, and that we are looking deliberately in terms of how we make sure that these patients then are not going to be harmed and they're going to be able to get access to care even while we're dealing with COVID-19. We think the system can definitely do that. We've talked to healthcare providers. We know that there is in fact capacity to do that. We know that there just needs to be a focus on it. So this is something important. We're proposing there be a working group on the care for chronic disease in other patients during a crisis. And we are recognizing that, when we get through this, and we're recognizing that many of the provinces are already feeling that we've gone through the apex of it, there will be a next wave, and definitely there will be more crises. So we need to have, as part of the planning for a pandemic, for an epidemic, for any kind of crisis, that we will also have at the same time planning for patients with chronic diseases, and certainly for us, patients with rare diseases. And in many cases, the rare disease patients are impacted even more because, as some of the patients say, if we go outside of our usual provider, people have never even heard of our condition. So we're trying to make the case, but people don't understand. We've also heard from some of the disease groups, and we also heard from some of the providers there. They have great concerns for their patients who are going into emergency, where the emergency doctors, and especially if it's an emergency around COVID, do not understand the very special needs that some of these patients with rare diseases have, or the very special care that has to be taken for patients who are on certain kinds of medications. So again, we believe that there needs to be this kind of parallel work going on to make sure that our patients, are not harmed, beyond, what would be, the case in terms of others with regard to their chronic care. So I think thinking ahead, we need to be prepared for how do we actually make sure that these patients have that kind of recognitions as well. And it may be, some combination of what patients are able and empowered to do and how they're actually able to approach their team. I'll just follow up with our big learnings, and I'll do it fairly quickly again so that if people have questions as well, we can get to them. We just came up with 4 things. It could be many, many things, right? Yes, of course, we support the fight against COVID and the ongoing fight against COVID, but we also are saying it's equally important that we don't neglect those essential care and treatment for patients with existing health conditions. We certainly don't want to lose people unnecessarily due to their existing health conditions, even while we're trying to fight COVID. One thing we learned is that you got to have a plan. In many cases, rare disease patients do not have a really good disease management plan. They don't have an individualized plan that they can own and they can share and they can make sure that is available to a healthcare provider or an emergency setting that they can actually refer to. So this is important. We've seen this in other diseases, but we really recognize now that we have to help set up a system where every patient with a rare condition has an individualized care plan, that this care plan is available in electronic form, and they can actually make it available when they're being treated, regardless of where they're being treated. Second thing is that we're recognizing that rare diseases has to be recognized as a medical specialty. In the US, we know this move is taken on. In Europe, there are specialized centers that are setting up. We need to recognize that patients with rare diseases have to have the kind of specialized team, specialized sites like oncology, like cardiology, like neurology. All of those things have really helped to actually ensure you've got comprehensive linked up care. And that means that having a specialized team that actually will extend into their local community, that will extend beyond just the site they're in, especially for many of these patients who live remote. I asked the question, what has been the disruption in terms of your medical team? And most people came back and says, what team? We don't have a team. And we have to kind of get to that point. That was the proposal under, Ontario, even in terms of a hub and spoke model, in terms of centers of excellence for rare diseases. How do we set those up? How do we link them up? The same as we do with oncology, cardiology, pediatrics, et cetera. Third is we have to deal with the crisis, but we don't sacrifice those other healthcare needs. And let's make sure then that we keep that in mind even as we go into a crisis. And it may mean that we've got a parallel team. We've got others who are available. And certainly our ongoing healthcare specialists, we're not drawn into that crisis, can in fact be working to help set up that parallel track for of services. So I think this has to be in place and we have to be prepared for that. And number four, I think it's very important, is that we recognize that Canada has to acknowledge we need an innovative pharmaceutical industry. We are quite pleased, and we know that companies have been asked to step up in terms of, ensuring that there's medicines and research and development in terms of vaccines for fighting COVID. And we know they have been. We also, at the same time, though, recognize that we're asking them also make sure you take care of, the ongoing, needs of patients with rare and certainly common conditions. And again, we're recognizing that they're making that effort to make sure that happens. And we think this might be the opportunity to really, really think about, how we develop those kinds of public-private partnerships that will allow us to work well together. It is a time, I think, for us to stop, kind of treating, I think, the pharmaceutical industry as if it were an enemy of the healthcare system, and to really, from this, be able to draw upon how do we develop those kinds of supportive partnerships. And with that, I think I will take us into any Q&As that you may have. Bill, I don't know if you've got anything that you can share with us.
Thanks, Durhane. And this is a time when I'm going to encourage, we have over 100 people on the line, and so I'm sure many of you have questions for Durhane. And there was one on acromegaly. Are they considered immunocompromised or more vulnerable? And another one of our attendees responded with a quick yes. That's the only question we have online so far. But I've got a couple in advance, and while we're waiting for folks to chime in. The first is, what do we do about post-COVID, or as the health system starts opening up? Did you see anything in the survey about worries that the health system is going to have a huge backlog of all the appointments that were either missed or delayed, or surgeries? Is that a concern, that there's almost two crises, one now in terms of a lot of those access and anxiety that we're seeing now, but could this continue, and is that coming out yet, or is that going to be the subject of another survey to find out what to do then?
We are planning to do another survey, because this was done immediately, as the COVID-19 was coming in as a crisis issue, and we began to move into lockdowns and diversion in terms of hospital services. We do recognize, and we've had, people ask us in terms of how are we going to be able to come out of this? What's going to be the impact in terms of care? The important thing to recognize is that in many cases, the kinds of specialists that we're talking about, right, are not necessarily the ones that are fighting the COVID-19. They're there. In fact, we've had some people say, like, we're doing nothing. We just can't get access to the hospital, or we, our doors are closed so that we aren't able to get people, or people can't travel to us. So there are people, and there are people within the system that are available. So I don't know that we're all going to be lined up behind the same kinds of services and people that are there, but there isn't a plan for how we're going to make this available. And I do think there could be a lot of pent up demand from the patients that are needing to get blood work, needing to get tests, needing to get access to surgeries, that are going to flood the system. And there doesn't seem to be a plan in place in terms of how we can actually deal with that in an orderly fashion. I'll tell you a bigger concern we have as well, though, Bill, and that is, and I say this very honestly because we've said it within our community, we're very afraid that as we move forward, that we're going to be told, as certainly as rare disease patients, sorry, we have no monies. The monies has already been used up in terms of healthcare. We also already got a letter, and I won't say exactly from whom or where, that was sent to one of our patient groups that says, how dare you ask for anything? We're trying to fight for COVID-19. We have no time for you. Or to say that, do you realize that, your quote expensive medication could actually, be used in terms of covering X number of patients who need hip surgeries? This is not a good response. And we are very concerned that unless we actually get it right and recognize that the lesson out of COVID is not that, we give some people preference and we give other people nothing, but that we can in fact take care of these needs in a way that's actually humane and affordable if we think about it in a different fashion. So I think for us, I think it's an important way that we can build on kind of how the system has responded to an urgent need, but we are afraid that down the road there may be that sense of, sorry, we're going to have to pull back on other healthcare because we've already used up all the funding, et cetera, for COVID. Not to say we're against COVID, but we have to help the system recognize that by not financing, by not funding the ongoing care and the preventive care for other kinds of chronic diseases, you'll end up with a bigger crisis and also bigger costs down the road. So let's make sure we use this lesson to say, what do we do to prevent? What do we do to provide care that's necessary? What do we do to make sure that we're engaging as much as possible in terms of the right kinds of care?
Excellent, and thanks for that. We had a follow-on question from a friend of both of ours from the rare cancer community around, this is less about what governments can do. What can patients do to be prepared with the return to work and the reopening of the economy and the system? Are there any tips that you've got, having lived through and helped guide patients through several crises in the past? And any tips for what patients can do as things may start opening up in the coming weeks?
It's interesting because it isn't obviously not our first crisis, and certainly not our first healthcare crisis, right? And I think we were certainly around when we had the issues around the blood system with HIV and earlier kinds of certainly widespread impacts, and we were all around for SARS, et cetera. I do think that for patients, one of the important things is to be well informed. Know your health condition, know what it is that your risks are, know what the kinds of treatments you need. The better informed you are, the better prepared you are in terms of how not only to get care, but also how to present yourself in a way that will get you the most appropriate care. That is important. So I think, and that was certainly a huge lesson we learned out of the blood crisis, that, patients need to be not only at the center of it, but they need to also be seen as in charge of their healthcare, and the system helps them do that. And we've had tremendous success in reorganizing care for, certainly patients with rare blood disorders in terms of their self-management of care. So the other thing we've gotten is that I got an interesting request from a patient group in Mexico who said, can you help us? Can you send out a video that would ask our health system to allow patients to get home infusions? As much as possible, move the therapies into the home so people can take care of themselves. And I kind of that's a great idea, and we should be doing that. What can we do that patients can actually be able to ensure that they're going to have best access? And that looks at some of the combination therapies. It looks at other kinds of therapies. The therapies that sometimes the system refuses to fund, they see as just being, oh, well, they're just going to make things easier for the patients. No, those kinds of things where you can go to oral therapies from infusion therapies, where you can go from infusion to home rather than being in hospital, where you can go to, ongoing home monitoring like we've done with diabetes. All of those things are important learnings. As much as possible, empower the patient, bring the care home to the patients. As much as possible, we as patients need to know what it is that we, can do in order to manage and ask for it. Speak up, We need to be able to move much of these services back into the community, back into the home.
Right on. Excuse me, we have a really neat question from somebody that, and actually a couple of suggestions. One is, how can we make sure that the lessons learned are actually brought out? And this question might actually be brought forward to the industry, or maybe you picked up something, because I know you're very plugged in globally on what's going on, and it reminds me of a lot of things that are happening, how a lot of the industry has grown out of the studies of the genes and rare diseases community. So how do you think COVID research into treatments and vaccines could potentially be leveraged later for treatments and research in rare neuromuscular diseases, in this case, such as myotonic dystrophy? So it might be a bit of a rhetorical question or suggestion, but if you have any insights, I think it's a kind of a neat idea to bring forward in future exchanges with the industry.
No, this is actually the wrong way around. If you look at the kinds of research that's being applied to the development of the vaccines, a lot of this grows out of the kind of gene research, genomics research that we've learned from actually studying rare diseases. So it's amazing. some of the techniques in terms of being able to develop a vaccine come from getting these vectors and being able to put a virus in it that it can actually deactivate, looking at the antibodies and the antigens and how can we, deactivate the antigen. A lot of this has come out of what we've already learned in terms of rare diseases, gene therapy. So quite frankly, it goes the other way around. That's why we say the more we invest in terms of what we can understand and know about rare diseases, the more we can also do in terms of the more common diseases. We see it over and over again. What we have learned from this is that if it is, in this case, it's a pandemic, we get it. But if you put the researchers onto it, if you give them the funding, if you give them support to do it, amazing things can happen. And that's what we need to leverage for rare diseases. Can we take that same kind of investment and that recognition, that investment in this research and the development of gene therapies and the development of preventive therapies are absolutely the key, not just to COVID-19 or other viruses that may be coming down the line, but very important in terms of many of our common diseases. So, yeah, we'll learn some things coming out of what we're doing in terms of COVID-19. But I will tell you, you read what's happening right now. They're learning a whole lot from what we've already advanced in terms of rare diseases.
Right on. There are a few other questions, but I think they're pretty specific around things like financial help post and through COVID, et cetera. And I think I think we might want to take them offline because we're now at 1:30, and I'd like you to flip ahead one slide if you wouldn't mind, Durhane, and
Yep.
maybe say a couple words about the upcoming webinars that we've got planned starting next week.
Absolutely.
And then go ahead.
Yeah, no, absolutely. We believe in leaving you wanting more. So if we're happy to take more questions, as I said earlier on, we will make these slides available, but we do have a report that's coming out and we're happy to make that available down the road and happy to take any other questions that you may have. And we will do a follow-up survey a little bit down the road. But as Bill says, we've got 3 seminars that are coming up. We'll be around back to some of the issues around access and federal controls and access, and some of it, as you will know, around what's happening in terms of PMPRB. So next Wednesday, we will have a webinar around the impact in terms of restrictive price controls on patients who are waiting for therapies, patients waiting for clinical trials, and you'll hear some of the case studies and hopefully from one of the researchers. On the 6th, we're going to have another one that we really want to bring into, in some respects, understanding kind of why these price restrictions are so challenging for industry and what are the ways in which the industry actually makes decisions about what drug gets launched or advanced in terms of research, how they make a decision in terms of where they will take a therapy, what does influence the decision there. So we truly do understand, not from a political point of view, but really from an understanding of how business decisions are made in this environment and what the impact then will be if we are not able to eliminate those restrictive price controls. And the third one will be, what are the alternatives? We have not ever had that really good discussion. What are other ways in which we can actually assure manageable prices and affordable drugs in an environment, in this case maybe even more accentuated, post-COVID-19. We'll bring in an international expert who has written on this, and hopefully a couple of our own policy economic folks to talk about why the current proposal doesn't work and what are the alternatives going forward. So we really hope that you'll join us for that as well.
Excellent.
And the registration will be available online.
Yeah, that's right. I was going to say it'll be available online, and for everyone who signed up for this webinar, when we send you a thank you note, those links will be embedded in there, as well as a link to the presentation that Durhane walked through today. And just a reminder too, it's also on the handout section of the GoToWebinar control panel. So, hey, that was fantastic to be able to get through all of that in half an hour plus 3 minutes, Durhane. And thank you to everyone on the line who signed on. And we will be putting this up on CORD's YouTube channel as well as SlideShare. Welcome your suggestions for future topics and webinars, and keep the questions coming, and we'll do our best to get to as many of them as possible in the future. So, Durhane, any final words before we close it out?
You know what? Mind the physical distancing. Keep the faith. We will make this work, and that's for all of us. So, huge kudos to everybody for what we're doing.
Excellent. Thanks so much, everybody. We'll see you hopefully next Wednesday at noon.
Thank you. Thanks, Bill.
No worries. Bye-bye.
Bye.